I know.
All right, Dr. Emer, you're live.
Hey guys, it's Dr. Emer. We're in West Hollywood, and apparently I'm Papi Chulo tonight. It's the end of the night, and I keep thinking it's Friday, but it's Saturday because we had a great clinic today, and we're doing some training today. And one of my patients here loves when she has her temples and brows lifted and filled because she exercises a lot and she loses volume here really easily, and also this comes down. Also, she loves when her cheekbones are enhanced because it blends everything in. So we're going to use a little bit of Juvederm Voluma, and that's going to help me give some lip to the deep temple and lateral cheek, and then I'm going to use regular Juvederm Ultra to lift the brow, and it's going to be great. So what we typically do in these scenarios is we go all the way down to the temple, but we use this in the more superficial temple or lateral part of the temple, and this will give her a nice little pop. It's like a deep foundational support, and there's not a lot of pain in this area because it's right on the bone. And then the other thing I like to do is blend this with the cheekbone, and for her we're just going to do 2 little dabs right in the back. 1, 2, make it pop, just so we get what we call an improvement in the ogee curve. And I always tell people it's not original gangster, it's OGEE, which is an area of beauty. It stands for blending of the temple, eye, and cheek area. So we're going to do that same thing over here, going into that deep temple area, giving support. And this Voluma will last typically at least 1 year, maybe even up to 2. Most of my patients that exercise, tend to metabolize fillers, so that's why we use a little bit of a longer lasting filler in them, like Voluma, because it has the Vicross technology. Now we're going to go towards using Juvederm Ultra, and that's going to allow me to go a little bit closer onto the bone, and we're going to just hold, we're going to put our finger right here in the ridge, and we're going to build. We're going to build up that filler right at the edge, and then I'll do a cannula method in a second. But what this will do, and you can see, look, it's already lifting the lateral brow. Put a little ball of filler right here, and then what you do is you smash it. You smash it down, and that will go. Look at that lift already, just that little press and smash. We're going to come over here again to that area of the temple. We're going to go right to the edge of the brow. Same thing. I'm going to hold my finger right here at the ridge. Let that filler build. Build it up. Right at that lateral third of the brow. And then what we're going to do is smash. Okay, and that will cover the full ridge of the brow right there. Good, Rosa will hold here. I'm going to switch to cannula now. So now I'm going to switch to the cannula.
Somebody saying that they like your hair.
Hey, mine or hers?
Your hair, Dr. Emer, yes.
Thank you. Got my haircut today.
Nice.
Shout out to Barcode Barbershop. They're known for the best fades in the city.
Look at that
All
fade.
Latin. All the Latin guys and girls. They know how to fade, I'll tell you. They're the best. My barber has been cutting people's hair since he was 4.
Wow.
He cut everyone in his family. So now, and it's on my Instagram, you guys. If you go to my Instagram today, I did a story at the shop. So we're gonna go now. We did that deep lateral edge of the temple, or of the brow. Now we're gonna go down all the way to the ridge of the brow. Right here, you can see where we are with the cannula. It's gonna feel weird.
And why are we using a cannula?
Well, this is safe. There's blood vessels and nerves here, guys. We want to make this safe. So we want to give her a nice lift. We're going to give some support to the back of the brow. You can see it building up right there. Okay. And to the lateral third of the brow, because this is where people lose a lot of volume as they get older. They just lose it. Okay. So look at that. Right there. Fill it right in the brow. Massage it, massage it, massage it. Look at that lift. Look at that instant lift.
Wow.
Gorgeous.
Nice, huh?
You can definitely see
She's
it.
gonna love it. I already know. She gets so excited when we do this.
Mm-hmm.
So Juvederm Ultra right here, going into the fat pads behind the brow. Okay, again, weird feeling. 1, 2, 3. Go right in there. Going all the way across the brow.
How does it feel?
It feels fine.
Yeah?
Mm-hmm.
We're supporting the ridge of the bone, right on the bone. And remember, there's fat pads here, like I said. And as people age, they start to lose them. So we need to replenish them, keep them up. So here we go, nice massaging there. And then I'm gonna show her this. Let's do an Emer reveal. Okay, hold on, let's get a little cleaning. Let's do an Emer reveal. You know how to do that. Hold on, let's do a little alcohol, a little clean. We're gonna do Emer reveal, which means you're gonna hold the camera and take a quick flip and look at your brow. And then we'll do my favorite
Are you ready?
Botox for
I'm
crows.
ready.
So what do you think?
Oh, I love it.
Right
I
now,
can see
obviously a
all the
little
arch.
swollen, but what do you see?
Oh, but that's okay. I see a nice arch
Mm-hmm.
lip. I see it fuller. Oh, I love it.
Turn Joey Jangle, show everybody.
I
And
like
filling
it.
out the temple, lifting of the brow, little lateral cheek. What do you think?
Oh, I love it.
Just
And-
that subtle
yep.
hint at the
It's
OG
it's nice
curve.
and full.
Great.
That's
So
good.
now, just look in the mirror, look in the regular mirror. You can take that back, flip
Okay.
it around, flip it back. Look in the mirror just because I want you to see there's a different perspective in the mirror.
Oh, yeah.
You see what I'm saying?
Oh, yeah, for sure.
Just so much
all
better.
up in here.
Oh, yeah.
Very nice.
Nice and blended.
And more, it's tight.
Remember,
It's
this
nice
is
and-
three-dimensional contouring. This is what happens as you age. You lose volume, you lose bone, everything starts to fall. So instead of filling a line, we're lifting, we're volumizing, we're creating a foundation. She's an exercise fanatic, she's a mom, makes everything want to droop. We need to lift it. That's what we got to do. So step 2 in lifting, part of the without a trace lift, like I told you guys, what does that mean? We keep talking about this. Without a trace with Dr. Emer means you walk into the office and you walk out like no one knew we had anything done because it was done without a trace. And that includes Botox, fillers, threads, and lasers. So here we are in step 2, doing the Botox lifting around the eye. And it's gonna help her crow's feet. Just smile as big as you can. When these muscles, when this moves, you see how it pulls
There
the
we
brow
go.
down? Relax. We wanna do a little bit of Botox right here. And that is going to allow us to stop those movement lines because she's a smiley, happy person, which is great, but that affects her brow. Smile again. So we hit every area, and the only one I would say we just do a little teeny bit to here just to give her full effect around the eye. And that's going to lift the brow
Love it.
and help the pros. So smile as big as you can. Smile. You see everything is moving here, so let's go right to where it's moving. Let's work on this lateral part of the auricularis. Let's work on this medial central portion. Smile again. Great. Let's go right to this lateral edge, and then all we need to do left is that little bit. Smile as big as you can. She's got a little creepiness right here, so we're just gonna do a little baby pinch. Done.
How long does Botox last?
Well, this is going to be, everybody's different. The more you metabolize and move, the faster it's probably going to go. So 2 to 4 months is what I tell people. Plan every 3 months. 4 times a year, do it. Otherwise, you won't be as refreshed looking, it won't be as open, and you may not appear as happy to people. So we want people to be, we want to be approachable. So this is our beautiful, without a trace eye lift. And within 2 weeks, she's going to get even more lifting because the Juvederm is going to hold a little water and lift everything up. And the Botox is going to stop pulling down on the brow and making her eye look less open. It's going to be like more open cat eye type of look.
I love
Okay?
that. Yes,
Love that look.
Love that.
All right.
Yes.
Say goodbye.
Bye.